Thank you, Chairwoman and Mr. Secretary. Good afternoon. Welcome to our humble little subcommittee. It's a pleasure to have you testifying before us today to hear your views about the fiscal year 2020 budget proposal. The President's budget provides Congress with an important blueprint for our appropriations process and with the policies that this President and his administration would like to see in the coming fiscal year. As you know, under the Constitution, no money may be spent from the Treasury unless it is appropriated by Congress, and in a perfect world, no money would be appropriated unless the expenditure has previously been authorized. The Energy and Commerce Committee is a principal authorizing committee of the United States House of Representatives. And I believe this is a critical task, and it's important to get input from the Department of Health and Human Services when we are authorizing or reauthorizing or reforming programs that are under your control. While we do hear from the boots on the ground in our districts, it is the agency that both oversees the implementation of these programs and provides funding to ensure that the organizations can carry out the initiative's goals. Secretary Azar, thus far in your tenure as the Secretary of Department of Health and Human Services, you have proven to be immensely helpful to this committee and its work. You and your team have been responsive to our requests for information and for input, and you have made yourself available to members so that we can hear about your priorities and your intention to work with Congress on a number of initiatives. I will say this, of all of the Secretaries of Health and Human Services over the years that I've been in Congress, I have found you to be the most transparent and accessible, and I can look forward to continuing to partner with you on your efforts to improve access and quality of health care for Americans. One issue that I have raised in each hearing in this Congress, and one that I hear consistently from constituents back home, is the cost and complexity of the healthcare system. North Texans frequently tell me that they can barely afford their insurance premiums, let alone the costs they must pay to seek the care they need, especially those with high deductible plans. Secretary Azar, I know that addressing the cost of health care and specifically drug prices has been a priority for the department under your leadership. I hope this committee, being the one with the primary jurisdiction over these issues, will work with you as we consider ways to solve these issues. Additionally, as the Energy and Commerce Committee primarily drafted landmark laws, including the 21st Century Cures and last year's opiate effort, the Support for Communities Act, we should conduct responsible oversight to ensure that the Department of Health and Human Services is implementing these laws in alignment with congressional intent. It is encouraging to see that the President's budget request seeks to expand treatment and recovery support for individuals suffering from substance use disorders, in addition to enhancing prevention of addiction in the first place. While it is important to stem the tide of addiction, we cannot ignore those who have a legitimate need for pain treatment, including cancer patients, patients with sickle cell anemia, and others. To that effect, the budget requests $500 million to use for the National Institute of Health to partner with private industry to work towards the development of non-addictive pain therapies, in addition to addiction treatments and overdose reversal technologies. Additionally, I am encouraged to see that the budget proposes a significant sum of money for childhood cancer therapies and significant money to defeat the HIV/AIDS epidemic. Both efforts are worthy of congressional support. Another important agency within Health and Human Services, the Office of Refugee Resettlement, is required to provide care for unaccompanied alien children, a task for which your agency was unprepared when this crisis began in 2012, when President Obama signed an executive order enacting the Deferred Action for Childhood Arrivals. While conditions and quality of care have improved, the number of illegal border crossings continues to increase. And let me be clear, the Office of Refugee Resettlement does not enforce immigration law. They receive children as a result of other agencies' enforcement activities. President Trump's budget includes $3.7 billion in fiscal year 2020 for the Unaccompanied Alien Children Program. Congress charged the Office of Refugee Resettlement with the care of unaccompanied alien children, and I hope this committee will support those dedicated HHS and ORR employees as they continue to work with integrity in the face of baseless allegations. If Congress does not want you to undertake that task, Congress should change the law. It's not up to you.
Gentleman's
it's up to
time
us.
has expired.
I yield back. Thank you.
Thank you.